Welcome to the Mamas of It YouTube channel. My name is Gina. I'm a perinatal fitness trainer and mom of 4, and I have pelvic organ prolapse, and I still lift heavy weights. So in this video, I'm going to break down how you can continue to lift heavy while you're squatting, while you're deadlifting, and things that you can do to help with lower body exercises, even with pelvic organ prolapse. If you've received the diagnosis that you have prolapse, you may have been told that you should never lift heavy again. You should never do deep squats. Just don't touch weights. You may have been given a really long list of things that you'll never do again because of this diagnosis. The good news is there is a lot that you can still do with pelvic organ prolapse. And I would think of it almost like looser skin after you give birth. Our bodies are different after we have a baby, but it doesn't mean that there's a functional issue. And pelvic organ prolapse is just that. Our bodies are different, but having a prolapse does not mean that your body is less functional. So you can absolutely still lift heavy, run far, run fast, and do all of the things to have an active life, even with a prolapse diagnosis. But if you are lifting weights and you're feeling more symptomatic, or you're figuring out how can I continue to do this while protecting my pelvic floor, let's break down how you can continue to squat and deadlift while lifting heavy weights. The first thing is going to be to learn how to coordinate your breath to your movement. How we manage pressure, or how we move air and change pressure within our abdominal cavity, is going to influence the type of pressure that we feel against our pelvic floor and against those pelvic organs. When we breathe, we're going to inhale, the diaphragm flattens and moves down, and it increases pressure down within our abdominal cavity. This helps to generate intra-abdominal pressure, which means there's more pressure within the abdominal cavity, and this helps to stabilize our spine and to help stabilize our pelvis. We need high levels of intra-abdominal pressure when we're lifting heavy weights to help stabilize our spine. But if we don't have the tissue integrity yet to withstand the increase in pressure, we may not be quite ready to lift heavy weights again. And so you may find that during pregnancy, in the first and second trimester, we can lift a little bit heavier. But once we go into the third trimester, and then in the postpartum, usually like the first 3 or 4 months postpartum, we may not be able to lift super heavy just because our tissue is a little bit more stretched and thin just from pregnancy and healing postpartum. In addition to the intra-abdominal pressure, we can have muscular activation, or a contraction and lift up in the pelvic floor and the core, to help counter this increase in pressure with our exercising. So this means that you can inhale and breathe into your back at the top of your movement, and then either continue to inhale as you lower down, or you can inhale, hold your breath to generate that intra-abdominal pressure, lower down, and then at the bottom, we're going to exhale to lift up within the pelvic floor. So we're essentially going to inhale with gravity and then exhale when we move against gravity. So when we're doing our squats, we're thinking inhale into the backside of our body to help stabilize our spine. Either continue to inhale as you lower, or hold your breath and then lower down. And then at the bottom, we're going to exhale to lift up within the pelvic floor to counter that increase in pressure. Learning how to coordinate your breath to movement is going to help you stabilize better, but also help to protect your pelvic floor if you do have a pelvic organ prolapse. So how do you know if you're lifting too heavy? 1, as you do the movement, your form is going to be compromised and you're not going to be able to maintain good form. And 2, you're going to feel more pressure down into the pelvic floor on exertion. So when you're coming up from the bottom of the squat, you may feel more pressure downwards. So what can you do if you realize that maybe the lift is a little bit too heavy for you? 1, you can lower the weight. But if we reached a point where maybe the weights are really light, we can add in a little bit of extra support. So you can take a yoga block or a foam roller or something to place between the thighs, and then you'll squeeze that block. This is going to help to activate the inner thigh musculature, which attach to your pelvic floor, and can help to stabilize and support the pelvic floor. So I have the block between my thighs, and then you can lower down to a box to help decrease the range of motion, because maybe the depth is a little bit too much. And then exhale to come up. So the same breathing pattern, I can inhale as I lower, exhale as I come up, or I can inhale, lower, and then exhale as I come up. Adding a little squeeze between the thighs can help to activate the inner thigh musculature to support your pelvic floor so you can continue to lift. And then adding in the box can help to add some support at the bottom, decrease your overall range of motion so you can be more supported as you do your squat movement. So even if you have prolapse, you do not need to omit squats, and you can still lift heavy and you can still have a really deep squat. But if you are having more symptoms, adding in a little bit of support so you can continue to still do the movement and strengthen in a more supportive way may be more optimal. Now, when it comes to doing a deadlift, this is going to be our hinge motions where the hips are moving back towards the wall behind you as opposed to the floor below you like a squat. This is going to help to strengthen the hamstrings and the inner thighs, which can really help to support that pelvic floor. So I definitely recommend incorporating some sort of deadlifts within the movement. In addition, since the hips are a little bit higher, if you are having more symptomatic prolapse, this movement may be even more comfortable for you. Similar to a squat, we're going to inhale as we lower and then exhale as we stand up. So we're always thinking about inhaling with gravity and exhaling against it. So I'm going to inhale at the top, breathe into my back, lower down while inhaling at the same time, or inhale, hold my breath, and then lower. And then I'm going to exhale to lift up in the pelvic floor as I stand up. So inhale, lower down, and then exhale, stand up. Similarly, if you're feeling more discomfort within the pelvic floor or you're feeling heaviness with the lift, we either need to lower the weight that we're doing or we can add in some supportive modifications. The first one is going to be to add that block squeeze to increase adductor activation. And then you can do that same lift either with your kettlebell or your barbell. Or we can also add in a staggered stance. We'll step the left foot back and the right foot a little bit forward. For a lot of us, we have normal asymmetry within our pelvis where the left hip sits more forward and right hip sits more back. So a lot of us tend to have a little bit more tension or tightness to the back half of our left pelvic floor and a little bit more overactivity to the right half. So finding the opposite position by bringing the left hip more back and right hip more forward can help to kind of offset the uneven torque within your pelvic floor. So your left foot will be a little bit more back, right hip a little bit more forward. If you want to add a block squeeze, you can, and then you can grab onto your weight. So we can inhale to lower down and then exhale to stand up. And sometimes the slight stagger stance with the block squeeze can help to support your pelvic floor more in a deadlift movement. When it comes to lifting weights with prolapse, we don't need to completely omit any exercise, but we may need to modify to a point that feels best for us. Number one is going to be to learn how to manage pressure properly and to coordinate that breath to movement. When we inhale, we feel our rib cage expand out to the side and to the back, and we're going to inhale with gravity or when we're lowering down. And then we're going to exhale to lift up in the pelvic floor, whole belly to spine, and we're going to exhale against gravity. And then when we're going to inhale with the descent or inhale and hold our breath will really depend on what phase of life we're in and how the movement is feeling for us. If you're in your third trimester and probably the first 3 to 4 months postpartum, we're probably going to inhale as we lower down just because our tissue integrity is not that thick and it's not going to be able to withstand high levels of pressure. You also may not be able to lift very heavy weights during this time frame, but remember, it's just a short phase of life, maybe 6 months total, and outside of that, we can lift much heavier. In addition to learning how to coordinate your breath to your movement, we can also add in some modifications for more support if you are feeling more symptomatic. This is going to include squeezing a block between your thighs to help increase adductor activation to support your pelvic floor, and then changing our setup. Maybe we're doing a box squat instead of a full deep squat. Maybe we're doing a stagger stance with our deadlift, and then potentially lowering the weight if you are feeling more symptomatic. You shouldn't have to omit any movements though. We can just find some modifications that are more supportive for us. A prolapse diagnosis does not mean that you can never lift weights again, you can never run again. You can absolutely live a very active and full life, even with prolapse. And I know that it's true because I do it. I have pelvic organ prolapse and I'm running marathons, I'm lifting heavy, and I'm living a very full and active life, even with 4 kids. And if you want more support throughout your pregnancy and your postpartum along your fitness journey, I would absolutely love to support you to feel so good within your body during pregnancy and in the postpartum. It's my mission to help you feel strong as you navigate your pregnancy and your motherhood journey and to feel good in your body as you do it. You can use code YouTube10 to get 10% off any of our online offerings to include our education courses and our fitness programs, and you can bundle them together to save an additional 15% off.